All right. Hi, everyone. My name is Alex Su. I'm in the Faculty of Rehabilitation Medicine here at the U of A, and I'm a first-year master's student. So to start off this presentation, I really want to talk about what patient-oriented research means to me and the value it has in society. So my project is in specialized physiotherapeutic exercise and in adolescent idiopathic scoliosis. So the reason I think it's important, it's about perspective and good teamwork. So shown here is the 2012 Team Canada gold medal winning team. And I think that patient-oriented research, good patient-oriented research, is teamwork that everyone has a role in. It's about listening to everyone's voices, creating a platform for everyone to be heard equally, and sharing their expertise. Talking about my project more specifically now, so my research is in adolescent idiopathic scoliosis. This is a population of teenagers from 10 to 18 years old, affects 2 to 3% of all adolescents worldwide, and it occurs for no known reason, which is the meaning of idiopathic. It mainly affects females in terms of treatment, so this is something that is quite relevant worldwide, and I'm interested in how we can affect their spine in these side-to-side curves. So here the image on the left is a mild scoliotic curve. So as you can see, there's this side-to-side curve, and at severe curves, it becomes quite detrimental. So these patients or these individuals have severe physical and mental impairments later on in life. So the reason why we want to create different treatments for this with physical therapy is this proposed model. So I like to liken this model. It's a progressive model where the more curvature you have, the worse it gets due to uneven loading. So it's similar in my explanation to weighing down a young tree, like a bonsai tree. So currently in North America, the treatment we have is actually very passive. We have this wait and see treatment, and then as it progresses getting worse, we have bracing and then surgery. And this is really, really harmful, I guess, to the mindset of patients and their families, and really taking away power. So this is why we approach physical therapy exercise. So specialized physiotherapy exercise, called physiotherapeutic scoliosis specific exercise, has been a proposed method of helping patients empower themselves, give control over treatment. And this is really done mainly by a randomized control trial that's actually going on in Edmonton and Montreal. So the issue with this is you have to gauge expectations versus reality. You have to understand what these exercises are going to achieve for you. Patients and families really want to know, what can this provide to me as compared to what's already out there? Should a physician give it to you? Should a physician prescribe it? So in my project, we're using ultrasound imaging as an alternative way to assess the spine while also doing these functional positions and physiotherapeutic scoliosis specific exercises. So seeing here is a standing position in a frame and then sitting on an exercise ball just normally to see if these functional positions change the severity of your curve. So explaining more about the ultrasound imaging in our study, normally all spine assessments are done by X-ray. However, as an adolescent, as a young child, you really shouldn't be constantly assessing somebody with X-rays. So this is why our team here in Edmonton has developed an ultrasound technology that's validated and is comparable to X-ray. So what I do with these ultrasound images is I take these scans, transport them into a 3D image so I can space locate and I can determine all the orientations of the spine, and then I incorporate it into a MATLAB software where I can do all the basic measurements that you would do in a clinical context. So these physiotherapeutic scoliosis-specific exercises contain a lot of complicated positioning, so correction of the hip, correction of lumbar region, thoracic region, spine movements, as well as counter-traction, so lots of muscle incorporation from your shoulders, and as well as specialized breathing methods. So ultimately, this sounds all technical, and what's the point of it, right? We want to know what's the patient relevance. How did this even become a question for you? Why are you doing your master's project in this? So when we're looking at these parameters, what we really want to impact here is looking at big different groups in our clinical context. So from a surgeon's perspective, They want to know if these exercises actually achieve what they're supposed to, if they could potentially make a curve worse for a patient. So clinically, when we made this question, we asked the surgeons at the Stollery Children's Hospital, and they wanted to make sure that if they're going to prescribe these exercises, they can make a good ethical decision. In terms of family and community, caregivers, parents, constantly, in that respect, they also want to provide the best options for their children. They don't want to simply just wait for the children to get worse to a point where they need surgery. They want to be aware and they want to be informed and they want to help their children at the end of the day. And finally, looking at the population that means the most, obviously these children, they suffer self-image issues growing up as a teenager. You don't want to be left out. You don't want to be wearing a brace. You don't want to be seen as somebody odd, right? So it's really about empowering them, giving them that control of their body again, and improving their psychological health as well. So in terms of knowledge translation, what I'm working with is the Curvy Girl Scoliosis support groups in North America, so in New York and Ottawa, as well as presenting at conferences. My research will be incorporated at the University of Alberta Physical Therapy program, as well as the Barcelona School of Physical Therapy. So is my project perfect? I definitely don't think so, but it's a step in the right direction. And having a good direction with all the potential different ways you can assess something, patients can definitely help you lead to a better choice. So, I mean, really, at the end of the day, a series of small things brought together can lead to something great. So as this Van Gogh quote goes, I really think it's really applicable to patient-oriented research, and this is my favorite painting. So I'd really like to think that all these little pieces can really make this magnificent piece of art, which is patient-oriented research. Thank you.